My name is Jess, and I feel like I'm a hunchback with this giant ball that I have on the back of my neck.
That's massive. Rejuvenation Nation, I'm Dr. Anthony Youn. I'm a board-certified plastic surgeon, and on this video, we're gonna react to a pretty extreme Dr. Pimple Popper episode. That is massive.
My bump looks like a hideous softball sticking out of the side of my neck. The lump feels squishy. Unless I start pressing on it, then it becomes firmer.
Well, my friends, you always wonder how somebody lets something this huge get out of hand. So first of all, what is this? And my answer to you as a board-certified plastic surgeon is, I don't know. I think it might be a lipoma, but the first thing you need to consider is where this is at. And where this is at is close to his spinal cord. That's always something that I look for whenever I have a patient who comes in with some type of mass in the neck or the back area that's close to the spine.
I try to hide it with my hair, but the bump is so big, it'll still show through. It's disgusting and it looks ugly.
There are not a lot of things other than a lipoma that can create a mass so large in an area like this. Now, infants can be born with something called a cystic hygroma, and this is an outgrowth in the neck area, but typically that's in an infant, not in an adult like this. Now, you always have to worry about cancer. You know, is this some type of a malignant mass? That would be unlikely because as large as this is, at some point it would have created more than just a mass. It would have actually likely eroded through the skin. But the first thing that I would do if he was my patient is I would get an ultrasound or a CT scan to see exactly where this mass is and does it actually interact or connect with any underlying deeper structures. Because as a doctor, the first thing you need to do is do no harm.
My condition was first noticed by me in 2000. I'd been in medical school before. I was there 3.5 years, so I knew almost for sure that it was a lipoma.
So he went to medical school for 3.5 years, and then what? Now, there are people who I went to medical school with way back when, and I went to the Michigan State University College of Human Medicine, and there are people who actually finished medical school and didn't do residency and never actually became actual licensed physicians. It's a lot of work to go through not to become a licensed physician. I'm not sure if this is what happened with this gentleman. But the other thing that he mentioned in this segment is that he believes it's a lipoma. A lipoma is an unnatural growth of fatty tissue in a part of the body. And technically, lipomas are not considered to be dangerous. They're not cancerous. They don't, let's say, grow into other tissues, invading them or anything like that. But they can grow bigger and push on surrounding structures. The good news is that insurance will typically pay to remove a lipoma.
4 years ago, my wife was diagnosed with stage 4 lung cancer. Lost her 5 months ago.
Oh wow, that's really sad. So what does a stage 4 lung cancer mean? Stage 4 means that it is at the most advanced stage. And stage 4 cancers have typically expanded beyond the original tumor and have basically metastasized into other parts of the body. Unfortunately, the case with lung cancer, if you're stage 4, it has about a 12 to 18 month average survival rate after the diagnosis, which is obviously a very, very short period of time.
When you lose your wife, it's as if you had died. It completely turns your world upside down.
Now, I've been married for 25 years. My actual 25-year anniversary is coming up in 2 weeks. And so I know what it's like to have this type of a relationship where if you lose that person, your life would just turn upside down and would never ever be the same before. Like my life would essentially end if I lost my wife. Yes, at some point I would pick up the pieces and move on, but I could not imagine my life without her. So I really feel for him because I can't imagine what it would be like to lose a wife. And it said, I think it was what, like 5-6 months ago that this happened to him.
Staying at home all the time, that's not a healthy lifestyle. Thinking about dating again, maybe? That would certainly help you out.
Well, of course.
So I'm all for getting out and, you know, being a part of the world again. But if it's literally only been, what, like 5 months since his wife died and his sons encouraged him to start dating again. Now you got to take this at the speed in which you feel is right for you. And for some people, you know, after losing somebody, you know, in this manner, it can be years before they feel comfortable dating again. For other people, maybe 6 months is enough. It just depends on the situation, and it's nothing that I personally would ever judge somebody. But yeah, it's only been 5 months, so If he's ready, then that's great, but I would never ever push somebody to try to get to that place. When you think about the best times of your life, what comes to mind? Well, to me, it was my last couple of years of high school. Life was so much simpler when all I had to worry about was whom I would ask to prom and where we would go afterwards. But when I really think about it, my best times are now. My parents are in their 80s but healthy. I'm married to a wonderful woman and my little pups are happy. Well, life goes by so quickly that sometimes it's hard to stop and actually savor the life that you have right now. Well, therapy gave me the tools to deal with the daily worries that used to creep into my head and cause me to have problems sleeping and relaxing. And I believe it can help you too. Thank you to BetterHelp for sponsoring this video. BetterHelp is on a mission to make starting therapy easier. They'll connect you with a licensed therapist who is trained to listen and give you helpful, unbiased advice. Just fill out a questionnaire and you'll match with a therapist in as little as a couple of days. And you can easily switch therapists anytime at no extra cost if it's not the right fit. Well, I believe that everyone can benefit from therapy, whether it's me, my family, or you, my friends. Click the link in the description or go to betterhelp.com/Dr. Youn and get 10% off your first month of therapy.
But I am weary of possibilities that can happen. For example, it could be the painful surgery, or that there's an infection, or that there's...
Whenever I perform surgery, the first thing is always to make sure that the worst thing possible doesn't happen. I always think about, whenever I operate, what's the worst thing that can happen to this patient and how do I prevent that? So this is kind of what he's doing. He's like bringing up, well, these are the worst things. It could be really painful. I could get an infection. I could get scar tissue. I may be unhappy with the result. But in the end, you have to look at the benefits and the drawbacks. And for him, yes, there are going to be some drawbacks. There will be some discomfort in the recovery. There will be a scar afterwards. There is a risk of complications. But those benefits, when you've got a mass that size hanging from the back of your neck, those benefits are pretty darn high. And so in general, I would think that that would weigh out definitely on the affirmative of, hey, let's get this treated.
It does say there's a possible infiltration of the posterior aspect of the left sternocleidomastoid muscle.
So it looks like my good friend Dr. Pimple Popper did what I would do and got imaging on this patient before deciding to do the operation. And what that means is that that lipoma is potentially infiltrating the main muscle of the neck, the one that you basically see sticking out, the sternocleidomastoid muscle. Now, the good news with that is it's a muscle, okay, and a muscle is not the same as infiltrating next to, let's say, a really large vein or a really large artery. That would be much more concerning. But the number one thing is you got to make sure that this is truly just a lipoma and not more of an invasive cancer, which once again, I think is very unlikely given how long he's had it and the fact that it's just kind of slowly grown and hasn't created any ulcers or anything like that in that tissue.
What the CT is saying is that the lipoma is extending into this area on the side of his neck, which is where some really important structures are, like your carotid artery.
So now we're getting to exactly what I mentioned earlier, is what's the worst thing that can happen if you do this operation? And for him, it could be dissecting that out and you nick the carotid artery or you nick the jugular vein. That could be an absolute disaster, and you've got to obviously do everything you can to prevent that. Now, I love Dr. Sandra Lee. She's a good friend of mine. We are on text chains together. We DM each other here and there. But for me as a board-certified plastic surgeon, this is definitely something that I personally would probably do in an operating room with the patient completely asleep, possibly even in a hospital, depending on how close that mass is to those internal structures.
Blunt dissection is one of my favorite moves.
Oh, it is?
Blunt dissection.
So what does he mean about blunt dissection? Well, blunt dissection basically is when you dissect through the tissues without actually cutting it.
I'm not sure what to do with my hands.
Okay, so if you take a knife or you take a scissor, you're cutting through the tissues. That is sharp dissection. Blunt dissection oftentimes is literally taking your fingers and using your fingers to kind of dissect through and divide tissues to separate, let's say, this fatty tumor from the overlying skin. The biggest example and the most extreme example that I've ever seen of blunt dissection is I used to work with a plastic surgeon in my training, an old school doctor, fantastic doctor, who would do tummy tucks under a blunt dissection. So he would make an incision from hip to hip out of a tummy tuck and then take his gloved hand and literally using his hand, he would dissect the whole like tummy tuck elevate that skin by taking his fingers and literally pushing it between the fat and the underlying muscle and fascia, separating it out and literally taking it. Now, I do it now with cautery. We use cautery to kind of elevate the skin off a tummy tuck. He would literally just use his hands and just take his hands and ram them underneath the skin, elevating the skin off the muscle wall. It was crazy, but it worked.
You okay here?
Oh, that
Okay,
I'm
that's that nerve.
Yeah, that I'm good.
It's very difficult to navigate this real spider web of nerves in this area.
There are two ways that lipomas can come out. The most satisfying way to remove a lipoma is you've got this little mass there, you make an incision over it, and you squeeze it, and it will literally sometimes pop right out. And it's so satisfying. It literally, you can almost hear it just kind of popping right out, and it's all usually circumscribed, meaning it's got tissue around it that kind of keeps it in this ball. But there are other lipomas that are more like a cluster of grapes. And those are really frustrating because they have little tendricles of little fat pockets that may extend in all different directions where you squeeze it and it doesn't just the whole thing pop out, but you gotta now take it piece by piece, trying to go after each piece. That can be really difficult and it can be very tedious, but when it does pop out like that, it is so satisfying.
You can see that it's not sticking out, okay?
Oh, geez, that's so nice. Oh, God almighty, that is so nice.
I do have to hand it to Dr. Sandra Lee in that she did this under a local anesthetic in her office, and so far it looks great. Let's see what his final result looks like.
For years, I've had this ball on the side of my neck, and it feels amazing, great lightness on the side of my neck now that it's gone.
Well, kudos to Dr. Lee for such a fantastic result, and I'm so happy for him. Hopefully this helps to open up the next stage of his life after having such a huge loss. Well, if you enjoyed this video, you gotta take a peek at this reaction to a Dr. Pimple Popper episode where a guy has feet of stone. Yes, it's like the thing. How does she treat it? You really enjoy watching this one. Take a peek at it right up here. And as always, remember to eat real food, use clean skincare, and auto-rejuvenate before you operate.